Time now for the WTV report. Let's take a look at the headlines. Now let's get started. President John Dramani Mahama has signed 3 landmark bills into law, establishing a value for money office to tackle inflated government contracts, a council for legal education to reform access to the legal profession, and a governor's advisory council to promote good governance and trust in public office. The president signed the bills on Monday, describing each as a fulfillment of specific commitments his administration had made to Ghanaians and a concrete step towards building a more accountable, transparent and competitive state.
There's the Legal Education Act to regulate legal education and ensure the highest standards in terms of legal education, but also to open up the space for more opportunity for legal education in Ghana. This is the Governance Advisory Council Act. If you remember, it was one of the promises I made to promote good governance and trust in public office. And it's also been passed by Parliament, and I've given assent to it. And there's the Value for Money Office Act. It will help promote accountability. This office would review procurement and make sure that Ghana gets value for money. It would end the issue of inflated contracts. Also, source contracts will go to the Value for Money Office, and all contracts above a certain value will go to the Value for Money Office to make sure that Ghana is getting value for every CD that we spend. Signed.
Now, commenting on the Value for Money Office Act, Finance Minister Dr. Kaysel Atuforsen said the legislation will fundamentally change how government contracts were handled, pointing to the unchecked overinflation of public sector contracts as a drain on national resources that the new office was specifically designed to stop.
In the past, the legal division of the Ministry of Finance has been the one that conducts Value for Money Office. They did not have the requisite skills and ability to deal with value for money. And so what we've done is to properly institutionalize the Value for Money Office. President Mahama, as part of his campaign pledge, promised to establish the Value for Money Office, and today he has graciously assented to it following Parliament's passage. I want to use this opportunity to assure the people of Ghana that the menace of public sector padding of contracts and overinflation of contracts will be curtailed by this signature. What we seek to do is to use the next 6 months to properly constitute the office, nominate the leadership of the Value for Money Office, and constitute the technical team that will ensure the implementation of the Act. And so I believe that beginning 2027 January, this office will be fully implemented and Ghanaians will see the need of a Value for Money Office. I have seen Value for Money Office being operated in other countries, and I can tell you for a fact that if there's one single office that can pay for itself from day one, it is the Office for Value for Money Office, because it's reduced public expenditure and obviously create fiscal space that will be used to develop other sectors of the economy. Thank you.
And on the Legal Education Act, Attorney General Dr. Dominic Ayine described the legislation as a much-anticipated reform that would radically transform legal education in Ghana and create equality of opportunity for all persons aspiring to join the legal profession.
Anticipated reform bill or reform law that is supposed to radically reform legal education to create equality of opportunity for persons aspiring to be lawyers in this country. As a result of the fact that presidential assent has been given to the law, we are now ready for implementation. Immediate implementation will start with the establishment of the Council for Legal Education, which is the body that will oversee legal education in the country. We'll also start the process of accreditation of the law schools that will be running the law practice course for those who have LLBs and desire to write the bar exam. All of that will start this year. We'll be making budgetary provision for the implementation in the 2027 budget to be announced by the finance minister in November this year.
And away from the bills, President John Dramani Mahama has arrived in Nairobi, Kenya to participate in the Africa Forward Summit, a high-level France-Africa partnership meeting organized by French President Emmanuel Macron. During the summit, President Mahama will join discussions on green industrialization and energy transition, as well as the reform of the international financial architecture, focusing on sustainable financing for African countries. He will also co-chair a roundtable on health under the Accra Research Initiative. On the sidelines, he scheduled 4 bilateral meetings with UN Secretary General Antonio Guterres, the IMF Managing Director Kristalina Georgieva, and IFAD President Alvaro Lario to discuss global issues. From the president, WTV has taken health outreach to the heart of Abilinkpe community on Monday, May 11. The station organized a comprehensive health screening for market women and residents of the Abilinkpe Santana Market and surrounding areas as part of its 2026 Mother's Day celebration under the Mother's Day Treat initiative. Over 400 women benefited from the exercise, which offered vital health assessments, including tests for diabetes, high blood pressure, malaria, typhoid, hepatitis B, blood group analysis, physical examination, and one-on-one counseling. Women who were not yet enrolled on the National Health Insurance Scheme were registered on the spot, while those with expired cards received assistance with renewal. Queen Mother of the Santana Market, Comfort Ikuban, expressed gratitude to WTV, its medical partners Total House Clinic and Garnet Medical Center, and sponsors including Verna Mineral Water, A1 Bread, NHIS, and Event PR for organizing the event.
Partner the management of WTV by organizing this important program to honor our mothers. We see ourselves as partners to the health system in Ghana, and so we are showing our support for this beautiful program that we are putting up here. So today we are here to provide some education to the public, and also sensitize them on the mandate of the Ghana Medical Trust Fund, also known as Mahama Cares, and then to make some information available to potential beneficiaries, so that when they have to apply for the trust fund, they will know how to go about it.
And we are proud to be part of this initiative because the larger majority of our customers are women, and we believe that they have helped our brand to grow, to progress, and also they patronize our business in a way that we really appreciate. So it is with so much honor that we feel that you have to be a part of this event that gives them the opportunity to be screened, to check their health and all of that. So for today, Trillium and Verna is here to hydrate and refresh all the participants of this event. And we hope that from here, people will patronize our brand more and then give us the opportunity to be able to support events of this nature.
I'm so grateful to have you guys here this morning. As you can see, our background is shite. Our market queen, our market women are here. A lot of them are on their way, even coming to grace the occasion. And myself, I'm here. Periodically, you are supposed to do that. At least twice in 6 months, you are supposed to know your health status, whether you are doing well or you are falling apart. You should try to know all those things.
In what way are you contributing to this initiative? I mean, the whole process, what's your contribution to it?
Okay, so we started by doing a PR. We did community engagement with the people. We did announcements around. We informed our market queens around. We did a lot of visibility involvement so that they will troop to the place. So this is what we did in support of our project.
Will you be yourself an Oliver Twist this morning?
Oh yes, we are so grateful. It's just because of the ban on noise making. So we are not able to reach out to a lot of people, but we are doing that with our small ways. We are doing that, and we hope that you come again.
Celebrate our mothers. We are saying we appreciate them. So this is our little token to support them.
Happy Mother's Day!
Thank you. Thank you.
And now from Abelenpe, the Food and Drugs Authority, FDA, has reminded the public about the ban on the importation of turkey tail, commonly known as chofi, in Ghana. Despite the ban, which was instituted in 1999 due to turkey tail's extremely high fat content and associated health risk, it is still available in many markets where it is openly sold. In a public notice issued on Monday, May 11, the FDA stated that the ban was instituted to cover turkey tail and other poultry products with over 15% of fat content. The FDA highlighted that consumption of such products poses serious health risks, including obesity, high cholesterol, and heart-related diseases. The ban forms part of efforts to promote healthier eating habits and protect public health. The public is encouraged to make informed food choices and prioritize their health by avoiding banned or unwholesome poultry products. And away from that, the Ghana Medical Trust Fund, commonly known as Mahama Cares, will officially launch its nationwide patient support program in June 2026. Following a successful pilot phase in which 50 patients drawn from across the country received support for medical surgeries at a cost of 4.8 million cedis. Speaking at the Government Accountability Series on Monday, the administrator of the Ghana Medical Trust Fund, Najwa Obobia Dakopoku, said the pilot phase has tested patients onboarding, treatment monitoring, and claims management system ahead of the full rollout.
Gentlemen, I'm happy to announce that the Nationwide Patient Support Program officially rolls out in June 2026. But before that, the Board of Trustees approved the pilot phase, including 50 patients in the month of February. This allowed us to test our systems of patient onboarding, treatment monitoring, and claims management. These beneficiaries, drawn from across the country, receive support for heart surgeries, brain surgeries, chemotherapy, radiotherapy, and orthopedic surgeries. Over 4.8 million has been expended in the treatment of these patients so far. Beneficiaries ranged from 6-month-old babies to 85-year-old persons, treated across 11 hospitals. Ladies and gentlemen, preparations are far advanced for the official rollout of the Patient Support Program in June 2026. Following consultations with the Technical Oversight Committee, leading subject matter experts and stakeholders, the Board of Trustees approved an initial benefit package focused on cancers. The package currently includes comprehensive support for breast cancer, cervical cancer, prostate cancer, and childhood cancers such as leukemia, lymphoma, soft tissue sarcomas, retinoblastomas, and nephroblastomas. Additional disease conditions will be included in the benefit package by the end of the year.
She also announced that the Ghana Medical Trust Fund has made a strategic investment of over 36 million cedis to train specialist doctors, nurses, and pharmacists across the country.
Medical specialists. The Trust Fund has entered into strategic partnerships with the Ghana College of Physicians and Surgeons to expand specialist training centers and decentralize postgraduate medical education nationwide. We have also established similar collaborations with the Ghana College of Nurses and Midwives and the Ghana College of Pharmacists to train 100 specialist pharmacists and 100 nurse specialists in oncology, nephrology, cardiology, endocrinology, and neurology. The Ghana Medical Trust Fund has made a strategic investment of 36,234,475 Ghana cedis into the specialist training program as part of efforts to strengthen Ghana's specialist healthcare workforce and improve equitable access to specialist care nationwide. Through these partnerships, all regions of Ghana will benefit from expanded specialist training. These professionals being trained from all regions of Ghana will be required to serve in their local communities, ensuring that expertise is not a city-only privilege.
Time now for some international news. Now let's go to Nigeria, where dozens of Nigeria fishermen, I beg your pardon, let's go to Nigeria, where dozens of Nigerian fishermen are feared dead after Chad's military launched air attacks on Boko Haram militants in the Lake Chad region. Mohammed Abubakar Gamandi Usman, chairman of the Lake Chad Basin of Fishermen in Nigeria, said several of the union's members were missing and estimated more than 40 had died. No bodies have yet been recovered, but Usman believes some fishermen were hit by the strikes while others drowned after attempting to flee the overloaded boats. Authorities in Chad and Nigeria have not commented, but on Sunday, Chad's presidency said it had carried out retaliatory intensive airstrikes on Boko Haram strongholds. Now this brings us to the end of the WTV report. Many thanks for staying with us. I am Karen Naoyukwoti.